Welcome back to the Health is Wealth Connection. Today we have Brandy joined by our registered nurse here at the office, Lauren. Lauren is going to be discussing with Brandy all things IVs here at the office, different ones we offer, kind of what goes into each of those, maybe some pricing, and also our IV memberships. If you have any questions, of course, reach out to us, but here we go.
Hi guys, we're here today to talk about IVs, all the stuff. So we're here today with Lauren, and we hit the jackpot with getting her because not only is she a registered nurse, but she also has been practicing functional medicine for the last 3 years. She is a wealth of knowledge and she lives it in her own life, which I love seeing. So just want to give you a little background on her.
Yeah,
Welcome.
thanks, Brandy.
Yes.
Thanks for having me. Yeah, I'm a registered nurse. I've been in functional medicine practicing for at least the last 3 years, but in life for almost forever. My mom was very crunchy growing up, passed that on to me, and I love it. And yeah, I graduated nursing school in August of 22, and I've been loving it ever since, and I love being here. Yeah.
And her role here, so she wears many hats. We really just work side by side. She works as a nurse. She works as admin. IVs is one of your specialties, and she brought a better practice to us with all of her knowledge. So I guess let's start with, how does IV therapy differ from oral medication?
Yeah, good question. So the main benefit of IV therapy is that it is better absorbed by the body. You get a larger influx of vitamin infusion directly into your bloodstream. So it's bypassing the stomach. So your stomach's not, filtering through and only giving your cells just a little bit, but you're actually getting the nutrients directly into your bloodstream. So it bypasses, you get a higher influx and better absorbed.
Yeah, which is pretty cool. So if you feel like your gut's not in good status, doesn't have to just be Crohn's, colitis, you had a recent GI illness, it's a great way to better replenish some of those nutrients that you might be missing.
Yeah.
Or if you had too much fun on a weekend, that's another way to do it as well.
We can do a detox bag.
Yes, exactly. Well, heading into that, great question. What IVs do we offer?
Yeah, I guess I already answered one of them, but yeah, so we can do immune bags, which are really great for, if you're feeling sick or been around people who are sick or just kind of feeling, low energy, maybe starting to get a little sluggish.
Or maybe hopping on a plane.
Yes.
You're going to be going out of town.
Yes. We can do detox bags. So that's if your liver needs a little help detoxing, either from, partying, vacations, or again, you're just
viral illness.
Yeah, viral illnesses afterwards. Yeah. Beauty bags are really great. We add biotin into those. So really good for hair, skin, and nail health, and just kind of make you feel glowy on the outside. We have our Mamma Mia bag, which is for our pregnant mamas, maybe who are struggling with some dehydration, nausea, just overall feeling kind of blah through their pregnancy. We have a headache bag, and we can do this 2 different ways. We can just do straight medications to help with the nausea, the pounding headache, get some of that inflammation down. Or we can do medications plus vitamins to give your body an added boost through that headache.
Yeah, this is a great way. So I used to work in ER, as many of you know, but we have patients come in all the time to get a headache bag. It costs so much more money. Plus, we're taking up spaces from the ER that other patients potentially could use.
That's true.
So part of our goal, and to keep your membership so low, is to keep you out of the ER. And if we can do it here, that's less exposures, less time for you, and less costly.
Yeah, no, that's great. We can also do energy bags, which again, it's kind of in the name. It helps give you that good energy boost. Just if you're, again, kind of feeling sluggish, maybe you have a big project deadline coming up that you need, a little bit of boost through, or it's winter time. I'm right there with you. Just feeling a little low energy as we're coming out of winter. We have a Myers cocktail. That one's really good. It's just like an all-around bag, really good for a whole lot of different things. But I mainly use this for my patients post-travel to help with jet lag, especially if you've traveled to a different time zone, because it can help your body detox from the radiation exposure, jet fuel exposure. That's kind of why you feel really gross traveling. So I like to do that post-travel once you're home and settled. Weight loss bags, really good to aid our patients who are on weight loss journeys. It's not a magic bullet by itself, but it can really help alongside other treatments and things that you're doing for weight loss. And then just a basic hydration bag, just some saline if you've had like a stomach virus, you're really dehydrated, or maybe you have been working a lot outside in the summer and you can tell that your body's, depleted. And again, another way to keep people out of the ER and keep costs low for you guys.
Yes. And that kind of goes in this next question. Can anyone receive an IV? So a hydration bag we could use, and pretty much anybody can receive that unless you have heart failure, things like that. The reason I do love patients coming here is because we do have providers on staff. They're here when you're receiving your IV, because we do look at risk versus benefits, and plus you have us on site. We have an AED. God forbid we'd never have to use that. And we don't plan on it, but we Have everything in case you need it. We have an EMT on staff a lot of the times. That's me behind the camera. I'm wearing many hats as well. And then a registered nurse that's here. And we know our patients well. And say you want to come and you're not a patient, we're going to know your entire background first. And so we can safely do it.
In medications, like Brandy said, you can't get an IV if you're on calcium channel blockers just because some of the vitamins can interact with that. And you don't want to fluid overload yourself.
We may have to hold it that morning.
Right.
It just depends on why you're on it as well, if we can give it to you or not, or we just have to leave out some ingredients that could interact.
Right. And then for younger people, typically, unless you're adult size, you don't want to give someone an IV just because the dosages are going to be different with, dealing with pediatrics. It's just not safe. It's not studied. Just, anyone under adult size, we like to, unless it's a hydration bag.
Hydration bag. We can do that for kiddos if we need to. We wouldn't do the other things that went inside of it.
Exactly.
Okay, let's see. Can IVs be used preventatively?
Yeah, we actually did an IV day, I think, was it November before Thanksgiving, where we did, kind of just a little promo where we're like, hey, get yourself geared up for the holidays, traveling, seeing family, prevent yourself from getting sick. And we got a lot of good feedback from that. I feel like a lot of people came back like, wow, my nieces and nephews were sick and I didn't get anything and I normally would have. So definitely can see benefit from that.
I will say my husband loves when he gets to get an IV bag. It's not as often as he probably would like, but he used to travel a lot out of the country and he would feel like $1 million. I mean, he's definitely probably one of our biggest supporters.
He is. He loves it.
Are IVs painful?
I can't say they're painless, but they are virtually painless. You'll feel a little stick, little poke. And then once that's done, once that IV catheter's in you, it's smooth sailing from there. So,
yeah. We're all about making comfortable too. If we need to put some lidocaine on there, we take the time as long as you're not in a hurry. So it is really, everyone who does the sticking is very good. Let's see. What's the process for receiving an IV?
So at your first appointment, you're going to receive a big packet. And whether you're a patient here or not, everyone gets the same first packet just so I can go through any past medical history with you that might be good for me to know beforehand, just so we're infusing and prescribing things safely. And then I pull you back into the room and I have everything set up by the time you walk into the room. That way you're not waiting around for 30 minutes for me to get your bag all prepped. For that reason being, we charge you beforehand, before getting the bag. That way I can get everything prepped and you're in and out within the hour.
And that keeps our costs lower too, because if we're having to waste and throw away a lot of bags, that does increase the price.
Of course. Yeah. So we do everything we can to get you in and out quick, keep those costs low. And once I start the infusion, it usually runs for about 30 minutes, unless you're a little more sensitive, then I might do it slower. If it's your first time, then maybe about 45 minutes from there, but really quick, easy. And then you're on your way and you can always call me if you have any questions, comments, concerns after the fact.
Yeah, and whether you're a patient or not, if you've had an IV with us and you're concerned and it's a night or a weekend, we do offer on call just to check in with you once you feel comfortable and make sure you don't have any questions for it.
If someone feels kind of nervous about being stuck or if they're a hard stick, do you guys have any tool or anything that can make it easy?
That's a great question.
Oh, has it? Thanks for leading right into that. So this is our AccuVein finder, and it is super cool. And you guys may have seen it at some point for us, but we use this in a lot of our hard sticks, and a lot of people come. So we invested in this because we love our patients and we understand the anxiety and fear that come along with it. So if you're able to kind of look, can you see it from there probably?
This isn't my good arm.
Yeah, I know, but still, it gives us an area to look at when you can't feel as well as you may want to be able to feel. So we are pretty successful. I don't want to jinx us. I think we have a
high success rate. Yeah,
pretty much almost 100%. But so that's one way. We also have something that we can use.
Oh, the shot blocker.
Shot blocker. So you have the shot blocker. We also have even Pronox. So it's laughing gas. And that's something when somebody has a high anxiety, we can use it if we need to for additional charge. Yeah. I think the last thing we have is we have some memberships we can talk about.
We
want to
do.
explain to them?
Yeah. So we actually just rolled out our new executive IV membership. So with that one, you get one Myers cocktail infusion a month. So that was that one that I was talking about. That's just kind of your all around go-to bag. You're going to also get 4 in-body scans per year. And the in-body scanner looks at your skeletal muscle mass versus your body fat percentage. It looks at the right versus the left sides of your body, top half versus bottom half, just so you can see, where your body maybe needs a little bit more work or where you're doing really well and you can keep doing the same things. And we pair that with with quarterly nutrition consults. So you get to work with our nutrition coach, Cassie, and she'll meet with you quarterly after your in-body scan and just get to go over that with you and give you some tips and tricks there. And then you also get one complimentary B12 injection per month. And that just, again, can kind of help your body, gives you some really good energy, and gives you a little boost there. You're going to also get $10 a unit for Xeomin, and that's just our clean tox. It's like Botox, if you've heard of Botox, but a lot cleaner, better utilized and absorbed by the body.
Usually that's about $12 per unit. So if you think about how many units you potentially get, if you're somebody who gets, 50 units, you're saving $100 there. So it's a good deal with your membership if you're utilizing it.
Absolutely. And then you're going to also get 5% off on a bunch of other different services. So you're going to get 5% off on any additional IV bags. So let's say you got your Myers cocktail, 2 weeks later, you want to try out a beauty bag or an immune bag or something different. You can do that. You can add that on for an additional 5% off of that cost. 5% off of any supplements that we carry in office, 5% off any Zeo products. That's the skincare line, medical grade that we use here. It's really great. All the staff uses it and loves it. You're going to get 5% off any filler or other aesthetic services. So if you ever wanted to try anything else out in the aesthetic realm, you'd get a discount there, as well as 5% off of any of our laser treatments or packages, which are really fun and very versatile, from laser hair removal to skin tightening and collagen stimulation.
Yep, brown spots, cherry hemangioma. And the other cool thing is while you're getting your IV, you can actually get one of those services. And so it's a really fun kind of pampering type of day.
It is.
Thank you so much for coming and listening to us. If you have any questions, reach out, or if you have any topics you want us to cover in the future, please let us know.